Hariom. So welcome to our yoga practice and specifically our pre and postnatal yoga teacher training course. And this is our first class of our prenatal training. So what's important here in this class is you are going to be pregnant, all right? Because you're learning to be a teacher for pregnant women. So it is important that you have that understanding of how your body is going to be changing, and it will also help you know how to adapt things. Now, of course, here it's not exactly the same as being pregnant. Obviously, it's going to be much heavier when we have that belly. Here I've just got, look, you can see some cloth that I've put in. You could use a cushion. They will be all funny shapes, that's fine. Some people do like to have like a balloon which they put water in. That gives the heaviness, definitely. But whatever you want to do, you can put it in. So that will just give you an idea of how we need to adapt a little bit according to how big the belly is going to be getting. Maybe your belly is going to be 3-month belly, maybe 6 months, maybe 9 months. So whatever it is fine, but do put that in. Even though it might seem a bit funny that you're putting it in there, it will help a lot with your understanding. So let's start. So coming into a comfortable sitting position. Now in pregnancy, all the sitting positions are suitable. None of them are going to be impinging on the belly in any way. Even if I want to do the lotus position, I can still do that position if it feels comfortable for me. Of course, not every woman does feel comfortable in the cross-legged positions. They are a bit more pelvic opening, which is normally helpful. For some women, if they have a lot of pelvic instability and they're basically feeling that their pelvis is opening too much, then they might prefer something like Vajrasana, the thunderbolt pose. But for most people, they'll be very comfortable in a sitting position. So we know we've got lots of options. We can start with our cross-legged position, keeping the spine upright. There is a tendency to hunch in this one, so other options are usually better. You can have a very simple version of bringing the feet close to the body. So here, when we've got more of our legs on the ground, parts of our body on the ground, it makes our spine more stable. So it's very different from doing Sukhasana, the cross-leg pose. So we might want to do this. We might want to bring our foot a little bit higher. So we're moving into Swastikasana here, the auspicious pose. Or we might want to do like a half lotus, Ardha Padmasana or Padmasana. So whatever is comfortable for you. So come into that sitting position, and we are going to start today just with Jian Mudra. The simple Jian Mudra is index fingers and thumbs touching and our palms facing upwards. So our backs of our hands are on our knees, our shoulders are relaxed, our spine is upright. And remembering, for some people they might need to have a little cushion under the bottom, which will help them to keep their spine a little bit more upright. And also if one is having any knee pain, then you might need to take a different option, so there'll be less stress being put onto the knees. You can even have the legs straight out in front with the wall as a support. Okay, so let's start. So closing the eyes gently. And take a deep breath in and out. And again in and out. Just allowing the body to relax here. And now we're going to make a resolve for a happy, healthy pregnancy, birth and baby. And we're going to remember this resolve as we inhale. So deep inhalation, making a resolve for a happy, healthy pregnancy, birth and baby. And exhale, relax. Again, inhaling, making the resolve for a happy, healthy pregnancy, birth and baby. And exhale, relax. Okay, and we're going to be chanting Om followed by the Guru Mantra. So you can chant it with me. Om. Sakshat Parabrahma Tasmai Shri Gurave Namaha. Gurave Namaha. Gurave Namaha. Gently opening the eyes, we'll release our hands and just placing our hands in our belly for a moment and just again thinking of baby inside and sending love to baby. We're going to lay down in our side Shavasana today. Now you can do a regular Shavasana if you prefer, and in the first trimester regular Shavasana is fine. The second trimester to the middle is fine to lay in Shavasana. From the middle of the second trimester, so from about 20 weeks, it can get difficult for some women to lay on their back, especially if their belly is a little bit larger. They might not want to lay on their back. Basically, the pressure of the fetus can put that pressure onto the main vein, bringing the blood back from the lower extremities. So she might feel nauseous, she might feel dizzy, she just feels wrong. She doesn't know what it is. So from the middle of the second trimester, we may do other options instead of laying on the back. So today we're going to do a nice side Shavasana. So what we're doing here is, I'll get a bolster just to give you an example here. We're laying on our side, on our left side. Okay. So you can just have your head on the ground, you can have your head on your hands if you prefer, the knees can be bent. You can use a bolster or a cushion between the legs as an option. You can have a bolster or a cushion under your head too. Let's see here. This is really nice and comfortable. I've got my little cushion, I've got my bolster, I'm relaxed. Or I can turn my body a little bit and just have my leg on. This still keeps a nice amount of space so that we can be nice and comfortable. So whatever position you've taken here, the side Shavasana or the leg up onto the bolster, whatever it is, make sure it's nice and comfortable. And closing our eyes, taking a deep breath in and out, and again in and out, just allowing your body to relax. Relax your face, all the muscles of your face, your eyes, nose, mouth, and jaw. Relax your forehead, the crown of your head, the back of your head, your whole head. Relaxing your neck and throat, your shoulders, your upper back, your chest, the middle of your back, your lower back, your whole back. Relaxing your belly, your whole belly, the sides of your belly, your waist. Now relaxing your upper arms, your elbows, your forearms, wrists and hands. Relaxing your pelvis, your hips, your bottom, your thighs, your knees, your shins, calf muscles, ankles, and your feet. Relaxing your whole body from the crown of your head down to your toes. Take a long, slow, deep breath in and out. continue with relaxed breathing, feeling that with every breath you take, your body relaxes that little bit more. And now becoming aware of your baby. Visualize your baby inside your womb. Visualize your baby's face, eyes, nose, mouth, little lips. Visualize your baby's body, your baby's arms and legs, the fingers and toes, and visualize the umbilical cord connecting you and baby together. You're feeling relaxed and calm, and in turn, your baby also feels relaxed and calm. Visualize your baby floating in that amniotic fluid, relaxed, safe, secure, and loved. Sending love to your baby. Now slowly we'll release the position, slowly open your eyes, stretch out your arms and legs a little, you can move your bolster, and we're going to come up to sitting position. So see how I was laying on my side and I slowly push myself up to sitting. Okay, so taking care when we're moving between the prepositions. And Shavasana is really important practice for pregnant ladies to do, as it is for all yoga practitioners, but especially for reducing the heart rate and reducing the speed of the breathing, then also for that deep relaxation. So you want to teach her how to be able to relax very quickly and very deeply, so she'll be able to apply that to many experiences or things that are happening during the day. And if she wants to have a quick rest, she can lay down, she can do Shavasana, and she will feel energized. So a Shavasana is a really important tool for in your classes, but it's also really important for that pregnant lady to be able to do for herself. And as I mentioned, the side Shavasana, laying on the side, is the most suitable for a pregnant lady, and it's really, really comfortable, as you would have felt as well. And what we can do if we want to do a little longer Shavasana is we can put a little visualization in. So today we did one on baby connection, and that connection is really important to have between the mother and the baby. And I like to do that towards the beginning of the session too, because it's important she's thinking about her baby inside. And that means that she's not going to go and do crazy asanas and all sorts of things. She's taking care about her baby being inside. She's having respect for her baby, but she's also having respect for herself and all that her body is doing to grow this child. So it's very nice to have that at the beginning. It's also important to start building that connection more for your students, because if they don't feel that connection with their baby inside, then it can lead to lots of problems later on. So when the baby's born, if the mother is not feeling connected, there's much higher chance that she's going to have postnatal depression. There can be problems with breastfeeding. All sorts of things can start to come up if she doesn't feel that connection. So this is just a really simple visualization which can help to strengthen that bond. Alright, so we're going to come up to standing. So remember, you are pregnant today, alright? So here we're going to just lean forward, tuck our toes under, and every woman will come up a slightly different way. So whatever feels comfortable. So in our standing position, we're going to bring our feet apart. Now, it is helpful to have the feet parallel, not turning the toes out all the time, because when you turn the toes out, that's tightening your lower back more. And there is a tendency for it to become very tight in pregnancy. You know, there's this tendency, you see a woman, she's pregnant and she's like, ugh, I'm trying to walk. So we don't want that to be happening for our pregnant ladies. So having our feet apart. And when our feet are together, it's again a bit more stressful. When our feet are apart at hip width distance, it's a relaxed standing position. Alright, so what we're going to do to begin with is what I call baby prana movement. So put your hands on your baby, and we're going to inhale, opening our chest, looking up, and exhaling, bring our hands to baby. Okay, again, inhale, open, and exhaling down. And you might kind of hunch a little bit as you bring your hands down. So it's like you're getting that prana from the earth and you're directing that prana to baby. So again, inhale and exhale. Inhale and exhale. Inhale and exhale. So it's also a reminder for that lady what's happening here, because sometimes some women can forget, especially if their belly is not very big, and especially if they're feeling very, very healthy. Sometimes they forget baby's inside. So let's move on to our arm movements now. So we're doing these in a standing position. So we inhale, raising the arms from the side. So inhaling slowly, stretch up, and exhaling down. It's still a funny shape here. Again, inhale, open, and exhaling down. Inhale, open, and exhaling down. So this movement is really nice for opening up the chest, giving a nice stretch into the shoulders as well, and you're getting a little stretch into the back too. And if you want, you can also lift the heels. So for example, we inhale, raise the arms up, stretching up, lifting the heels here, you can see, and exhaling, heels down and arms down. It's also a really nice way to slow somebody down, because the tendency when we start this is, okay, I'm moving, inhale, like this. We don't need to do that. We can do it really slowly with awareness, and it will also help to expand our lungs, which sometimes can feel a little bit contracted and tight, especially when baby is getting larger and starting to kick upwards a little bit. So it's really nice to have that expansion in the chest. We'll go to the second one now. So we inhale, raising the arms from the front, and then exhale, turn your palms and bring your arms down. Again, inhale, stretch up, and exhale down. Inhale, and exhale. Last one, inhale, and exhale. Okay. Oh, and my fluffy thing is coming out. Alright, now we're going to do the third one, which is from the side. So we inhale, raise the arms, and exhale, crossing over and down. Back the other way, inhale, and exhale. Inhale, and exhale. Inhale, and exhale. And just roll your shoulders. Okay, so again, a nice opening. When you're crossing your arms over, for some it might just be the wrists or the forearms, for others it'll be the elbows or the upper arms. Whatever is comfortable to do. Okay, now we're going to bring our hands under our hips and do a nice gentle hip rotation. So this is something that you'll do a lot in classes. It's very helpful for loosening the pelvis, relieving lower back pain, and it's something you can recommend that your students do during the day as well. We'll go the other way. It's also a practice that we do in labour to help with the labour pain and also to help move baby downwards. Okay, so we've warmed up a little bit. We're going to come down to sitting position. So bringing the legs in front. So here, we're going to just support our body by bringing our hands behind and having our feet a little bit apart. So we're going to start with just some nice simple movements of the joints. So starting with the toes. So we inhale, stretching the toes, and exhale, clench. So here I'm talking just the toes, not the ankles. So inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay, so this is good for improving the circulation to the toes, and especially if the lady is wearing shoes all the time, she's not getting a lot of movement with her feet, then it can be very helpful, and especially for things like fluid retention. So she can be doing that kind of movement, she can do that movement up the wall as well, and it will be really, really good for her to do. Alright, now we'll move to the ankles. So inhale, push the heels forward, exhale, pointing the toes. Inhale, heels forward, exhale, point the toes. So continuing to do this movement. Now this is very helpful for improving circulation to the ankles, definitely helping for fluid retention, but also it gives a nice stretch into the calf muscles. And there is a tendency in pregnancy for the calves to become really tight. So we want to give that little stretch, and also not just tight, but for some women they will also find that they have cramps in their calves, often during the night, so it will help to prevent that. And the other thing that there is more of a tendency during pregnancy is Restless Leg Syndrome, where she might be laying in bed, you can continue to do it, she might be laying in bed and her legs are just not moving, but then she feels that she needs to move her legs. So she moves them, she gets some relief, but again that feeling that she needs to move them comes. So it can be very difficult to sleep when you need to keep moving your legs all the time. So doing this before bed is going to be really, really helpful, especially in combination with a bit of calf massage. Okay, so we've stretched out our calves. You'll also find that you can feel that in your knees. It's having a subtle stretch into the knees. Now we're going to do some ankle rotations. So inhale, toes towards you, exhaling downwards and around. So continuing to do this movement with the breath. So again, nice effect on the ankle joints. It is important that we work on all of the joints during pregnancy, and also these movements on the joints are preparation for doing other types of asanas. We'll go the other way. Okay, and relax. Now we're going to do the knees. So we're going to do knee contractions to start with. So this is where we're going to inhale, and when we inhale, we're going to press our knee down to the ground. So you can't see a lot, and then we exhale, relax. When we do it, we inhale, contract. You can see slightly my knees change. Exhaling, relax. You'll feel it in your quads, the tops of your thighs, and you may feel it around your knees as well. So let's do it. Inhale, contract. Exhale, relax. Inhale, contract. Exhale, relax. Inhale, contract. Exhale, relax. Inhale, contract. Exhale, relax. Okay, so this is really good for strengthening of the knees. It is important that we have good, strong knees in pregnancy. There is a tendency to have more knee problems especially because there's more weight. So normally, for example, if you're getting more and more overweight, it happens very slowly over a period of time. So your knees strengthen themselves as that happens. But with pregnancy, you've really only got a couple of months where that weight gain is happening. So it can take time for the knees to be able to adapt to that. So it's good to do these movements for the knees, also because a lot of our asanas do have an effect on the knees, and they can be quite tough on the knees, some of them. So we want to do lots of movements for the knees to prepare them. Okay, now from here we're going to do knee bending. So slowly bringing our foot towards us and then extending. So you see my feet are apart. If my feet are together and I do this, I'm going to start having a strong pressure on my belly. So my knees are apart, I'm bending my knee, and it might be that I have to bring my foot a little bit more out to the side. And then extending. So there's two ways of doing this. One way is I can use the floor as a support to slide and then extend, or I can lift up my foot, bend the knee and place the foot close. This one is going to be using a little bit of core, which is fine for someone who is used to it, but for someone who is new to yoga, they might need to use the floor as a support. Ooh, using the floor. Okay, so let's go to the other side. So you can use the breath here as well to do this movement. Okay, shake it out. All right, now we're going to do the half butterfly. So we're bending one leg, placing our foot onto our thigh. Now, if you're having pain in your knee, then instead of having your foot on your thigh, you'll place your foot on the side, okay, so your inner thigh. And what we're going to do is inhale, bring the knee up, and exhale down. So here you can see with my foot on, inhaling up, exhale down, inhale up, exhale down, just as far as it's comfortable to go. The knee or the leg might not touch the ground, okay? It might be here, like this, and that's okay too, whatever it is. Okay. Inhaling up, exhale down, inhale up, exhale down, and releasing. Shake out that leg. We'll do it on the other side. So bringing the foot onto the thigh, hand on the foot, inhaling up, exhale down. Inhale up, exhale down. Inhale up, exhale down. Inhale up, exhale down. Remember the option if needed. Okay. All right, and extending your leg. Shake out your legs. Now come to the front. We're going to do our butterfly. So everything we've done so far is suitable for everyone, as long as they feel comfortable with it. But with the butterfly position, it can be too strong for some women. And for example, if they've had a stitch in their cervix, then this might feel uncomfortable for them. And also for some women who are having a lot of pelvic instability, this can also be a bit strong. So we've also got other options. So instead of having the feet close, you can bring the feet further away. It's a much easier option. You don't feel so much into the pelvis as you would with the other one. So we're going to inhale, bring our knees up, exhale down. Inhale up, exhale down. Inhale up, exhale down. Inhale up, exhale down. Inhale up, exhale down. And holding it. So keeping the spine upright. And you can just bend forward slightly if you prefer. Normal breathing. release. We'll come back to a cross-legged position. Remember, baby's still there. Now we're going to do a few other movements. We'll start with some movements for the shoulders. So inhaling, lift the shoulders up, and exhaling down. Inhale up, exhale down. Inhale up, exhale down. Inhale up, exhale down, and relax. Fingertips onto our shoulders this time. So we inhale, bring your elbows towards each other, and up, and exhale back. Inhale, exhale. Inhale, exhale. Inhale, exhale. Now the other way. Inhale, exhale. Inhale, exhale. Inhale, exhale. Shake out the shoulders. Alright, we're going to do a few movements for the neck. So the shoulders are just, again, loosening up the shoulders, relieving tension that's in the chest and in the upper back. And we'll do more shoulder movements later on because shoulder movements are really important prenatally and also to prepare postnatally. So now we can do our neck. So again, with these neck movements, it's important that you do it very, very slowly. If you have any pain at any time, please stop the practice. For some people, the forward bending is rotating to the neck, so please go very, very gently. So we inhale, lifting the spine. Exhaling, bend forward just as far as it's comfortable to go, breathing normally. Now inhale up. Exhale to the side. So here, keep this shoulder down and this shoulder. Inhale up. Exhale other side. Inhale up. Now exhale to the side. Jian Mudra, so the chin is parallel. Inhale and exhale. Inhale. Now we're going to do the movement. Inhale and exhale, bend forward. Inhale, rotating to the left. Inhale to the back. Exhale right. Exhale to the front. Inhale right. Inhale back. Exhale left. Exhale to the front. One more time. Inhale left. Inhale back. Exhale right. Exhale to the front. Inhale right. Inhale back. Exhale left. Exhale to the front. Inhale, bring your head up. So a few different movements for the joints. We'll just do a little bit for the fingers. So pressing your fingertips and relax. Press, relax. Press, relax. Press, relax. And now the fingers. Press, relax. Press, relax. Press, relax. And the palms as well. Press, relax. Press, relax. Press, relax. Press, relax. Okay, we're going to do a little wrist movement. So slowly turning your palms out, down and around and together. The other way. Shake out your wrists, hands. Okay, so we've done some movements for the toes, the ankles, the knees, the hips, the shoulders, and the hands and the neck. Now we're going to move to our asana, one asana today, the cat pose, Mudra asana. So the cat pose is a pose that we use throughout the whole of pregnancy, and many women also use the cat pose at the time of labour. Some women even use it at the time of birth. The cat pose has a lot of benefits. The only thing to take care of is that when we're doing the cat pose, if we're in our last trimester or if the belly is getting particularly large, what will happen is it increases that back bend and it can pull down too strongly for some women. So I'll show you the option there for that anyway, but we're using the cat pose a lot for relieving tension in the spine, to improve the flexibility of the spine, and it's nice to have that movement, so not just a back bend or the arching of the back, but that movement going between the two, which gives a lot of relief for the body. It does have a strengthening effect on the abdominal muscles and the core as well. It also has a strengthening effect on the back, and it also gives a nice massage into the belly. So let's practice. So here what we're going to be doing is coming onto our hands and our knees. So our hands are under our shoulders, our knees are apart. And here first I'm in a neutral position. So my spine is neutral. So I'm not sticking my bottom out, I'm not tucking it under. Okay, so my pelvis is neutral, my spine is neutral. So if anyone has any difficulty with the knees, you can have a towel or cushion or blanket underneath your knees. And also for the wrists, if anyone has problems with their wrists, they might be able to put something underneath the hands so that there's not going to be such a strong angle. It'll be easier. You can also use your fists, or if you have had wrist injuries for a while, you might have something else that you can be holding on to instead. Okay, so for everybody else, we come back into the cat. Now we inhale, we stick our bottom out, we open our chest and we look up. Okay, and then from here we exhale, rounding our back, tucking our tailbone under, our chin towards the chest, and pulling our belly upward as well. Okay, let's do it again. So inhale, opening, and exhale, rounding. Inhale, open, exhale, rounding. Inhale, open, exhale, rounding. Inhale, open, exhale, round. Okay, and we're going to sit down and we're going to move into Shashankasana, child's pose. Now we can't do the regular one. We have to bring our knees apart. So we're bringing our knees apart and we're going to bend forward as far as it's comfortable to go. You might be able to get your forehead down. Now for some women, even in the 9th month of pregnancy, they can still get their forehead down and the space is there for the belly. But for some women it's not. Now, if there's not enough space, or if it's difficult to get the forehead down, or if what's happening is some women do this, okay? We don't want that. We want our bottom to be down. You can use a bolster. So here, if you don't have a bolster, you can use different cushions, you can use a chair. So you're moving the bolster so the space is there for your belly. So you're putting your chest onto the bolster and you're relaxing your head. Now you can turn your head to the side, or you can bring it down on the other side, whatever suits you, generally to the side. So it's really nice because you have the support of the bolster on your chest, but you have that space for baby, and you have that nice gentle opening of your pelvis and a nice stretch into your back. So it's actually a lovely position to do. For some women, they might also need 2 bolsters. Okay, so whatever, it will depend also on the bolster. Some of them, like this one's a bit soft. You might have a firmer, better one with you. So relax. Okay. Another option to take if you don't have a bolster is to have your elbows on the ground. This is also really nice. Okay, so take a position, any of those positions, close your eyes, take a deep breath in, body relax with each breath that you take. Okay. So putting your hands down, slowly walking your hands towards you. If you've been in this position for a while, you want to take care that you very slowly come out of it, because a lot of women might feel a little bit of dizziness with having their head down, and especially if they have very low blood pressure, or if they're finding that if they're not eating regularly enough, their blood sugar levels can drop and it can make them feel, that wooziness. So doing it very, very slowly. So this is one of the classic asanas we use in pregnancy yoga. Another is the cat pose, Mudra, which we've done, and the other is Titaliasana, butterfly pose. So all those three we use a lot. Now what we're going to do is take Shavasana. Okay, so we're slowly going to come onto our side and lay on our back. Now remembering the option that if a woman doesn't feel comfortable to lay on her back, she can lay on her side, on her left side, inside Shavasana. Now in Shavasana, while I've got the bolster, I'll show you here. You can put that behind your knees to be a little bit more relaxed. So we're going to do a quick Shavasana here. So bring your arms down by the side, closing your eyes, taking a deep breath in and out, and again in and out. Just allowing your body to relax. Inhaling peace, calmness, positivity. Exhaling any stress, any tension, any negativity. Feel the body relaxing with every breath you take. And not only the body is relaxing, but also the mind. Any stress, any tension, feel it floating away with every breath. Keep scanning your body. Check if any part of your body feels tense. And any part that does, any tension, any stiffness, just focus on that area and breathe into that area. And feel that area relax. The power of the mind can work wonders. If our mind is focused on relaxing our body, there are so many benefits that we can gain. Now slowly stretch your fingers and toes and bending your knees. We're moving into Tadasana. So in Tadasana is the pond pose. So normally when you don't have a belly, the belly goes down and the space that the water would be there, like a pond. So the Tadasana is actually a really good position for when it's uncomfortable for you to lay in Shavasana. So especially if you have back pain, Tadasana is a good option. And it's also a nice option to do pranayama or breathing practices when you can't be in a sitting position very easily. So we're going to be in Tadasana, remembering that for some women in the later stages of pregnancy might not be comfortable to lay on their back. However, when their knees are bent, it's usually much easier for them to do. But of course, if it's the last couple of months and they don't feel comfortable, give them other options. So we're going to lay in Tadasana. Our feet are apart, one hand on our chest and one hand on our belly. And just becoming aware of the breath as it flows in and out. Trying to deepen your breath. So inhaling slowly and exhaling slowly. And as you deepen your breath, the diaphragm will start moving down and the belly will come up. So when you inhale, your belly will rise, and when you exhale, your belly will fall. So just having that awareness of the breath and the belly. Follow the breath. Now continuing while I'm speaking, continue with the breathing. We're going to be doing deep breathing next with a ratio. So I'm going to be counting 4 counts for inhalation and 4 counts for exhalation. So that's 4 seconds in, 4 seconds out. So when you are doing deep breathing with counting, you want to make sure that you're going to be inhaling for the full 4 counts and exhaling for the full 4 counts. You don't want to be inhaling in steps. That's a different practice. You want to be inhaling smoothly and steadily, and you want to make sure that, okay, once I've got up to count number 2, I've already inhaled about 50%. Okay, so I shouldn't be inhaling like almost 100% by count 2. So I'm holding my breath. It should be a nice continuous inhalation and continuous exhalation. And if 4:4 is not comfortable for you, then you can continue with the regular breathing that we were doing. So closing your eyes again, focusing on your breath. Inhale, 2, 3, 4. Exhale, 2, 3, 4. 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 And normal breathing. So from here we're going to roll onto the side and coming up to sitting position. So it's important that we understand how to breathe deeply before we move into all the other kinds of breathing practices. So just a simple awareness of the breath and awareness of the abdominal breathing is really important. And then we can start with inhaling to counts. And over a period of time, we can start to extend that exhalation. So it's really important to learn how to control the breath with this kind of practice. And of course, this deep breathing is going to have really nice effect on calming the mind. It's going to be very helpful for anxiety, helpful for sleep, and all sorts of other problems. So now we'll move into completing of the class, where we're going to chant the prayer to Mother Nature. So you can come into any kind of cross-legged position, and here you can put your hands on your baby. If you want, you can just put your hands in another mudra. It's just nice to have your hands on baby because you can feel that connection, and it's especially nice when you're doing things like mantras. So closing your eyes, taking a deep breath in and out. Your spine is upright, your shoulders are relaxed, your head is up, your chest is open. So repeating after me. Durge smrta harsi bitim Ashesha Jantoho Swaste Smrta Mati Mativa Shubhandadasi Daridra Dukkha Paya Harnikatvadanya Savopakakarnaya Sadadrachitta Savamangalamangalye Shive Savata Sadike Sharanye Trambake Gauri Narayani Namostute. May there be peace in your body, mind and soul. As you inhale, remembering your resolve for a happy, healthy pregnancy, birth and baby. And exhale, relax. One more time, inhaling, resolve for happy, healthy pregnancy, birth and baby. And exhale, relax. Bringing your hands together, rubbing your palms, place them over your closed eyes, and then slowly opening your eyes and removing your hands. We'll just do Paradasana, the mountain pose, so interlock your fingers, turning your palms, stretching up. Inhale, exhale to the side, inhale up. Exhale, other side. Inhale and exhale, bring your arms back down. And thanking baby. So Paradasana is also a nice practice to do at the end of class. It's very good for removing any kind of tension that's there in the spine, especially after you've been sitting for a little while. And it helps to prevent things like back pain or relieve back pain. So it's really nice to do during pregnancy as well. So we'll finish the class here. Hari Om.